Hello, again, I'm Klaus Buergelt, veterinary pathologist with the College of Veterinary Medicine, the University of Florida, Gainesville, Florida. I would like again thank the C.L. Davis Foundation as well as the Armed Forces Institute of Pathology to make this presentation possible. However, I would at this time expand the gratitude towards the residents and faculty and staff of my institution, without whose help the presentation would not be possible. They were instrumental, obviously, in generating many of the pictures that I'm able to show. And lastly, I would like to acknowledge the participation of about 10,000 horses in this event, whose necropsies actually made it possible to produce this presentation. I'd like today to continue with the musculoskeletal system. This is my first slide. If we are talking about the equine musculature, we distinguish two types of muscle. Type 1 being a slow switching type of musculature, rich in oxidative enzymes. Type 2 being subdivided into A and B. Muscle type 2A is glycogen rich, and muscle type B is the fast switching musculature. There are a couple of disorders that affect the musculature of a horse, particularly as it relates to working horses and athletes. This is a set of muscles that's characterized by diffuse pallor. The Petri dish actually contains urine, which clearly has changed the color. It's of burgundy red, to suggest an influx, in this instance, of myoglobin. So we have lysis of myoglobin off the musculature due to some kind of burn-off effects, which is typically seen in working horses and equine athletes, also known as Monday morning disease. It's also seen to be associated with an excessive exertion, and as such, the disorder is generally defined as exertional myopathy. The initial changes affect the glycolytic fibers. There's pronounced myoglobinuria and myoglobinemia, as well as metabolic acidosis, which may be fatal in some instances. Individual instances of exertional myopathies are also defined as azoturia and tying up. Azoturia is a paralytic myoglobinuric event occurring very shortly after commencing work, following some days of rest. As such, Monday morning disease. Affected horses are stiff in the hind limbs, they sweat and tremble. Muscles affected are usually associated with the girdle and are grossly characterized by being pale, moist, swollen, and or hemorrhagic. Histologically, there are hyaline changes with little or no inflammation. Here again, evidence of pallor. Lately, additional entities have been described as polysaccharide storage disorder, mainly in warm bloods and draft horses. This picture, courtesy of that path, illustrates the presence of stored polysaccharide, particularly in type 2 muscles, as demonstrated by special stains such as PAS. These polysaccharides are diastase resistant, as well as they are negative if subjected to Congo red stain. Another form of polysaccharide storage disease has been described in young foals, particularly as far as quarter horse young foals are concerned. And this condition is known as Amylopectinosis, histologically characterized by the deposition of globular substances within the muscle fibers, which have lost striation, which have swollen, and again these are also PAS positive, diastase resistant, and Congo red negative as far as tinctorial patterns are concerned. A metabolic disorder that typically may affect quarter horses, American paint horses, and Appaloosas is known as hyperkalemic periodic paresis, hyperkalemic periodic paresis, HPP. The condition is marked by muscular fasciculations and muscular weakness. The disorder is transmitted as an autosomal dominant trait. Clinical signs last from 15 to 60 minutes. Respiratory stress and dysphagia may occur. Serum potassium concentrations are typically elevated up to 6 to 9 milliequivalent per liter during the clinical manifestations of a disease. The normal range of potassium is considered to be between 3 and 4 milliequivalent per liter. Here we have an affected horse. As it is recumbent in a periodic fashion, it is subjected to the development of abrasions and pressure marks over prominent bones, as you can see here. Not a nice picture. On to Pupra Hemorrhagica, a disorder affecting either the subcutis and or the muscles. The cause remains elusive, but a condition representing a hypersensitivity vasculitis to either streptococcal or viral antigens is postulated as pathogenesis. Affected horses typically will show swelling characterized or featuring edema of the hind legs, the ventral abdomen, or the front legs. It becomes clearly evident that the fluid accumulates in the subcutis, and there also is evidence of extravasation, and that indeed is the preceding condition in that vessels are undergoing a fibrinoid necrosis, causing a disturbance of permeability that results then in extravasation. As I indicated, it can affect the muscles as well. And if one looks microscopically anywhere in the affected tissue, there is clearly evidence of a necrosis affecting major arteries due to most likely an antigen-antibody complex deposition. Inflammation affecting the muscles are causing a myositis. Here is the musculature of the neck to show hemorrhage. It also will contain a gaseous material or air bubbles, and it will have a rancid butter smell. This is highly suggestive of Clostridia, and indeed this was a myositis due to Clostridium septicum. Here we have evidence of foci of what appears to be an infarct, and indeed it is in some instances an infarct, in other instances where the delineation is not quite as clear, a necrotizing hemorrhagic myositis. This is due to Clostridium shoveii, also known to induce blackleg. A portion of muscle that is characterized by streaks of white tissue suggests perhaps fibrosis, but this is not the case. This actually turned out microscopically to be an infiltrating lipoma, just like in the dog. A focal neurogenic myopathy is responsible to cause the Rohrer syndrome, and it is also known as laryngeal hemiplegia. The cricoarytenoid musculature associated with the larynx undergoes atrophy, laryngeal hemiplegia, due to an insult to the left recurrent nerve, and this situation is nicely presented here, where on this side the muscle tissue is poorly visible and has been somewhat replaced by fibrous tissue as compared to a normal pharynx, the Rohrer syndrome. Bone diseases are plentiful. One that is the result of nutritional hyperparathyroidism historically is the cause for what has been called Brand disease or big head disease, and here is such an affected animal. It is due to an excess of phosphorus obtained through the diet, such as rich in carbohydrates, to induce fibrous osteodystrophy of mainly the areolar bones of the head. A cross-section through the head reveals a enlargement, what appears to be an enlargement of bone tissue, but it is a very brittle tissue characterized by plenty of porous material due to a loss of structural bone, which is replaced by soft fibrous connective tissue. Degenerative diseases known as osteochondrosis dissecans, OCD, affect certain parts of the bone, particularly the distal femur, the tibia, or the scapulohumeral joint. Here we're looking at the medial condyle of the distal femur, which is characterized by a loss of smooth articular cartilage. There's ebonation, and there are many clefts and indentation, which are also, as a mirror image, present associated with the articular cartilage of the patella. OCD causes severe lameness and is thought to be perhaps the result of copper deficiency. It's typically seen in the young, fast-growing horse, and again associated with severe lameness. On cut section becomes evident that the basic change is associated with the subarticular cartilage epiphysis, which undergoes necrosis and clefting, and is a result of a failure of appropriate regulated endochondral ossification. Radiographically, the clefting and the distortion of the surface of the articular cartilage becomes evident quite nicely. The severity is quite impressive. Despite the fact that it's focalized, it has eroded a significant portion of the articular cartilage and the adjacent epiphysis. OCD needs to be differentiated against what's normal. This cleft, and this is a knife mark, this cleft is known as the ossification center of this particular bone. OCD also may affect the facets of the cervical vertebra to be partially responsible for the wobbler syndrome. On to some aspects of joint pathology in the horse. Exostosis may affect distal joints known as ring bone or spavin. An example is seen here. Navicular disease is multifactorial and causes significant lameness. It is a combined pathologic change associated with the navicular bone and the surrounding joint capsule. Podotrocleitis may be the preceding event. As far as the navicular bone is concerned, ebonation, a moth-eaten appearance, and the loss of a smooth articular surface, as well as adhesions with the adjacent joint capsule as well as the tendons is the feature for navicular bone disease. And then laminitis, being also multifactorial and is sequeler to enteritis, mainly induced by gram-negative organisms, as we already have alluded to. In conjunction with salmonellosis, it can be seen in conjunction with anterior jejunitis, or it also can be seen in conditions such as pontomic horse fever. Laminitis is characterized by a rotation of P3, a drop from its suspension to the sensitive lamina. In the acute form, the drop and rotation may be anywhere between 5 to 25 degrees as compared to the sole, and it is characterized by the presence of hemorrhage. It's easy to move P3, and as this drop recurs, it may lead to a perforation of the sole, a solar abscess, and necrosis of the distal portion of P3. Here again, an affected leg, usually the front leg, in an acute phase, and then this being a chronic form of laminitis to reveal the necrotic changes of P3 and a severe secondary inflammation affecting the surrounding tendons and as well as the sole. An incidental finding, but nonetheless of interest in a comparative fashion, was a ruptured meniscus in this horse. And I just want to add that to the pathology of joint diseases. very, very rarely, but nonetheless seen in horses, is HPO, hypertrophic pulmonary osteoarthropathy, characterized by a duplication of the cortical bone in conjunction with the presence of a pulmonary change, in this instance a large abscess in one of the lung lobes. So HPO on occasion has been described just like in the dog, and horses as well. Bursitis is characterized by the presence of a velvety synovial or bursal surface and some precipitations, inspissated pus, or even little stone formations. A swelling associated with the bones of the nose in a young horse suggests a cystic formation, and indeed it was a mandibular cyst that caused the swelling. When opened, it became evident that it has a very hollow lumen. And finally, a neoplastic growth is associated with the mandibular bone in this young horse was diagnosed as a myxosarcoma. On to lightning, an event that frequently requires a necropsy with a hope to come up with finding suggestive of lightning. The lightning strike is a huge spark which may be as long as 3 miles. It may be in the order between 12,000 and 200,000 amperes. However, lesions of lightning, if they are present, easily can be obliterated by postmortem decomposition. For this reason, a 24-hour reporting time of carcass loss has been suggested. The carcass diagnosis of lightning or electrocution by a loose wire is very difficult to make, as very few specific lesions are seen. Forget to look for arborizing singeing of the hair on the equine body. It's simply not present in conjunction with lightning. The most reliable change is clotted blood or hemorrhage in the trachea. Unusual fractures may be present, unusual as far as the location is concerned. Small pinpoint hemorrhages and bruises may be seen between muscles or in the soft tissues. It appears that lightning strike causes a rupture of the small capillaries, but the immediate cause of death is primary shock from fibrillation of the heart. Clostridial diseases and anthrax must be considered in the differential diagnosis. Let me then show you a couple of changes that we have encountered in animals that historically have suffered from lightning. One may see a postmortem distension of the jugular vein. One may see venous congestion in certain portions of the esophagus, clearly delineated with the normal color of the esophageal mucosa, something that looks like the bloat line as far as ruminants are concerned. One may see abrasions of the skin. One may see bruises of connective tissue or muscular tissue associated directly and intimately with bony structures. One may see fractures in unusual locations, such as the thoracic vertebra. One may see a fractured spleen or liver, and again, as far as the trachea is concerned, clotted blood arranged in a rope-like structure and fashion. These are, again, individual changes to suggest lightning. Most and utmost important is the report of the local weather station that clearly indicates the occurrence of a lightning in this particular area. So one needs to ask for such a report to be incorporated with the findings of a necropsy, which in many instances is very unawarding to establish cause of death due to lightning. The next system I would like to address is the urinary system. Here's a set of kidneys that show the normal appearance, anatomic appearance of an adult horse kidney versus one that is lobulated. This is defined as persistence of fetal lobulation. During embryogenesis and fetal development, the equine kidney is lobulated, which disappears with birth. Inflammatory changes affecting the kidney are defined as to cause a nephritis. A nephritis occurs in two ways. One is a hematogenous spread of organism to the kidney. The other one is a ascending infection from a preceding nidus somewhere in the lower urinary tract, particularly as it relates to a cystitis, which is known as the urogenous form of nephritis. If that's the case, the inflammation would be focused and concentrated in the lower medulla as well as around the pelvis. Hematogenous agents, as far as the horse are concerned, are certain bacteria, such as Lactobacillus E. coli, which typically will cause a thromboembolic bacterial glomerulitis, being characterized at the gross level by the presence of multiple discrete small foci scattered over the surface of the cortex. Microscopically, it becomes evident that a plethora of organisms has been showered into the glomeruli. When specifically stained, these will be gram-positive coccoid organism, Lactobacillus E. coli, starting as navel ill and being disseminated through the arterial circulation into end circulatory organs such as the kidney at the site of the glomerulus. Other organ systems affected in shigellosis or Lactobacillus E. coli infection are the joints and the lung. So it's a polysystemic disease, starting again with an omphalophleboides due to poor naval hygienics. A few other examples of infectious causes for nephritis. Here is a set of kidney to show various foci in the cortex. This was a case of candidiasis. I beg your pardon, nocardiosis. The next one was a case of candidiasis in a immunocompromised Arabian foal, whereupon the yeasts were very plentiful with very little inflammatory responses, especially stained the clusters and packages and foci of yeast deposition throughout the medulla are well presented here. A scenario of a pyelitis is depicted here, unilateral to extent the calyces. So this is suggestive of an ascending or erogenous inflammation. Helicephalobus gingivalis can involve the kidney in a granulomatous process mimicking renal neoplasia. The kidney is next to the cerebellum, the second most involved organ system as far as Helicephalobus gingivalis is concerned, a rhabdidiform nematode that causes a dry granuloma characterized by eosinophilic epithelioid macrophages and Langhans-type giant cells. And Klebsiella equi, an incidental finding mainly in donkeys, is a protozoan that inhabits the epithelium of the renal tubules. Renal lipidosis as part of a generalized hyperlipidemia, hyperlemia syndrome in donkeys or ponies. Not only affects the liver, the heart, but also the kidney. A couple of primary degenerative changes, endogenous induced nephrosis through either hemoglobin or metaglobin deposition into the kidney, changes the color of the cortex towards a tarry type of discoloration, and then papillary nephrosis secondary to the application of nonsteroidal anti-inflammatory drugs. Typically happens associated with the distal medulla, and it reveals itself as a discrete area of greenish discoloration. It is the interference of prostaglandin synthetase by the nonsteroidal anti-inflammatory drugs to reduce the protective presence of prostaglandins to regulate vascular pressure in these areas. That leads to a ischemic change resulting in nephrosis. Acute tubular nephrosis seen in this kidney may be the result of many external sources, toxins, nephrotoxins, which may be plants, drugs, lead, mercury, a variety of toxins can lead to nephrosis when severe, leading then to oliguria, anuria, and azotemia. Renal infarctions, showering from thrombi, particularly as they can be present associated with the semi-lunar aortic valves, emboli becoming entrapped in end circulation, such as the glomeruli, may reveal discrete wedge-shaped, on cut section, wedge-shaped areas of infarction. Cysts may be congenital or acquired. If they are present, they are mainly acquired and are secondary due to changes affecting the tubular apparatus of the kidney in end-stage kidneys, as you can see here. Many cysts affecting and involving the cortex. End-stage renal disease causes changes of uremia. These affected kidneys are shrunken, firm. They have lost the delineation, the clear delineation between cortex and medulla. The capsule is very tightly adhered, and again, maybe the end result of either a primary inflammation or a primary toxicosis. Certain agents, as for instance and for example, equine infectious anemia, are associated with an immune complex disease affecting the glomeruli, and here is such a situation where we have a severe fibrosis associated with the Bowman's capsule and a adhesion of the glomerular tufts, as well as a hypercellularity and obliteration of blood vessels, capillaries. Here again, unilateral chronic renal disease probably will not reveal the typical symptoms of uremia, as the unaffected kidney is quite capable to compensate for a lost function of one of the kidney. Generally, up to about 75% of the nephrons may become lost, and the kidneys are still maintaining function without producing clinical signs of kidney disease. Here on cut section, it becomes evident that again the delineation, the anatomic delineation and separation between cortex medulla is not visible in the affected kidney. Here again an example of a glomerulopathy leading to proteinuria as the primary hallmark of glomerular disease, most likely representative of a membranous glomerulonephritis. Stones do occur on occasions. They may be lodged in the pelvis of the kidney or in the lower urinary tract or in both segments of the urinary apparatus. Stones lead usually to focal inflammation that may take over, particularly if the inflammation is a result of a pathogen. And this is depicted here. The entire kidney is destroyed. There's very little normal tissue left, as one can see. A uniform distension of the pelvis or calyces creates a picture of hydronephrosis. One can expect and should expect an obstruction to the outflow of urine into the distal urinary tract, or a obstruction of the pelvis. In this instance, there is evidence of a nephrolith in this particular kidney. Renal tumors occur in a moderate fashion. They're typically involving one pole of the kidney and are carcinomas, renal carcinomas. Unilateral and relatively benign in that they grow locally but rarely do metastasize. This one, however, was a malignant primary renal carcinoma. And then lymphosarcoma, multicentric lymphosarcoma, may on occasion affect the renal kidney. Lower urinary tract diseases, cystitis is the result, just like in other mammals, of mainly gram-negative bacteria, and stones can be happening in the passages or the urinary bladder as well. Here is an example of a cystitis. Here is an example of urolithiasis, stone formation, causing a hydroureter and most likely a hydronephrosis. Occasionally, just like in the young male foal, the urinary bladder of an adult horse may rupture to induce a uroperitoneum, which is always fatal. Incidental findings are sand formations associated with the apex and focal necrosis. Here is a sand formation precipitating out in stone-like precipitations due to probably a paralysis, a functional paralysis of the urinary bladder due to some kind of pathology associated with the filum terminale, the caudal spinal cord. Here a focal area of necrosis associated with the apex of the urinary bladder. Incidental findings, maybe also the presence of a cystitis. Just like in the kidney, tumors may arise from the transitional epithelium of the urinary bladder. Transitional cell carcinomas obstruct and may be locally invasive in such affected animals. Diseases of the reproductive system. I'd like to present a couple of them associated with males, with the stallion. First of all, I would like to point out that unlike in other domestic animal male species, the epididymis in the horse is only very loosely, normally very loosely attached to the testis, as you can see here, which is important to know as far as practitioners are concerned that are undergoing castration in a very poor environment as far as lighting and so on and so forth concerned. Many times it may be only result in the removal of the epididymis and the target testis remains behind as far as cryptorchidism is concerned. Speaking about cryptorchidism, the two types, the abdominal or the scrotal cryptorchid testis, always is characterized by hypoplasia. It never develops to the expected size and function. And here clearly is the size difference, the descended testis on the left, a cryptorchid testis on the right, and again a relatively loose attachment of the epididymis to the testis. Inflammations leading to orchitis in the stallion are secondary to a peritonitis, whereupon the exudate descends down the inguinal ring into the area of the tunnix, and it starts first as a tunicitis. However, it will sooner or later involve the adjacent testis as well to induce an orchitis. Here is an example of a parasitic orchitis. The parasite involved is depicted sticking out from this cross section, and it is a larvae of Strongylus edentatus that may reach the testis all the way through the abdominal cavity, down the inguinal ring, and as one can see, is quite destructive as far as lesions to the parenchyma of the testis are concerned. A chronic end-stage testis is seen here due to an infection associated with a tunicus mainly, lasting over a long period. Tumors, primary tumors of the testis may occur in older stallions in the same way as they have been described in older dogs. Here is a seminoma that unilaterally caused testicular enlargement. I remember this case. The testis was removed and subjected to microscopic examination. It was diagnosed as a seminoma, malignant in that there was evidence of lymphatic invasion associated with the tunicus and also invasion into the vas deferens. And a year later, the horse came back with metastases associated with the entire abdominal cavity for a necropsy. So I think the diagnosis was certainly appropriate of a malignant seminoma. The intervention of castration, unfortunately, was too late. Penile diseases, frostbites, trauma may lead to erosions, such as seen here. However, one has to be very careful in just making this assessment. That may be also a change, an early change associated with hemorrhagitis, or even the presence of a very early but ulcerative squamous cell carcinoma. Herpes viruses have a genital preference. Choroidal exanthema is the example as far as the stallion is concerned to induce an erosive ulcerative change. It's the type 2 equine herpes virus that's responsible. There is evidence of balanitis and postphitis as well, discharge, and again, the diagnosis is made by the demonstration of intranuclear inclusions associated with the tissue. A proliferative ulcerative change seen here is a result of hebronomyosis, Summer-Sores. In order to make the diagnosis, one at least has to demonstrate an overpopulation of eosinophils. But if one is fortunate, one can also identify the larvae. Many of those are in the process of being digested and typically will create a reaction characterized by this eosinophilic rim, which is partially the deposition of fibrin and partially the degeneration of eosinophils. Again, a case of hebronomyosis affecting a large portion of the penis. At this stage, one also should think of squamous cell carcinoma, and indeed a biopsy is frequently taken in order to make the assessment of the nature of the lesion. It's either hebronema or squamous cell carcinoma. This really tends to be diagnosed readily as a tumor, and indeed it is a tumor, squamous cell carcinoma, a cauliflower-like tissue proliferation that is characterized also by significant necrosis, and it has a very foul smell. On to the mare, the reproductive tract non-gravid. The equine ovary is a peculiar structure and quite different to those of other domestic animal species, in that the mare's ovary has the medulla on the outside and the cortex on the inside of the ovary. The mare ovulates through the ovulation fossa, and the Graafian follicles of the mare may become quite large prior to ovulation. They may become as large as 6 centimeters, and that's very important to remember, not to fall in the trap to diagnose such a structure as a cyst. A well-functioning tertiary or Graafian follicle should not be confused with a cystic follicle. And then lastly, the texture of the equine ovary is very firm and is composed of fibroblasts that, if one does not know about the structure of this type of architecture, one can fall into the trap to call this a fibroma or a fibrosarcoma. Here is a opened ovary to make the point that the Graafian tertian follicles are quite large. Here is the stroma of the ovary to show the density of fibroblasts arranged in bundles and whorls. Again, should not be misdiagnosed as a fibroma or fibrosarcoma. And then also the corpus hemorrhagicum is a prominent structure which should not be confused with a hematoma or even a hemangioma or hemangiosarcoma. So this creates a rather unique situation, normal, physiologic, unique situation that one can encounter as far as the mare's ovary is concerned. Turner syndrome is a congenital disorder characterized by a XO chromosomal set creating juvenile ovaries and a sterile, basically a sterile mare, because these juvenile ovaries do not go through ovulation. Cysts may occur, but if they do occur in the horse, they are mainly around the ovary and known as paravariant cyst, congenital remnants of the Wolffian duct system or mesenteric duct system. Many horses are actually born with paravariant cysts, which strangely do not enlarge such that they may destroy and compress the adjacent salpinx or the ovary. Here's a good representation. They seem to stay for the rest of the life of the mare as a small structure measuring between 3 and 5 centimeters in length. However, intraovarian cystic cavitations do exist. Here's an ovary which isn't significantly enlarged as compared to the normal size. However, it shows cystic cavitations larger than 6 centimeters in some instances. This was diagnosed as a cyst adenoma, a tumor, benign but destructive as far as the ovary is concerned, arising from the surface of the ovary. The one, however, that typically reveals itself as polycystic and enlarged is responsible for the pathologic condition of a granulosa cell tumor. It is a unilateral tumor, a benign tumor in most instances, that does, however, interfere with estrus and typically assumes the size of a grapefruit. This is probably as best as it gets as far as the ideal profile of a granulosa cell tumor is concerned. It has a central, very central, large cavitation, and then if many much smaller cavitation being responsible for the enlargement of the ovary. Inflammation of the uterus causes a endometritis, metritis or perimetritis, a contagious infection that interfered quite intensively when it was present in many of the breeding installations with fertility, is known as contagious equine metritis or endometritis, being due to Haemophilus. A gram-negative organism revealing itself through severe hyperemia associated with the cervix, vagina, and uterus, and vaginal discharge, purulent discharge. In a very severe case, it was involved in the formation and development of a pyometra. On to endometrial biopsies. It is something that the horse industry is very supportive of to assess fertility and the evaluation of the mare as far as the chance to not only conceive but carry the foal from conception to term. However, the endometrial biopsy only should be evaluated in conjunction with other types of investigation, starting with the mare's history as far as reproductive health is concerned, a good clinical examination, and additional microbiology or virology testings, including ultrasound. Adequate tissue samples should be obtained, and they should be adequately fixed, ideally in Bouillon's solution, for no longer than 24 hours. Until that time, the biopsy should be transferred either into alcohol or formalin. And then appropriate knowledge is the prerequisite as far as a meaningful interpretation of a biopsy specimen is concerned. In the literature, several classification schemes have been developed indicating the prognosis and the chance towards carrying a conceptus to term. The most widely used grading system has been established by Dr. Keeney some 25 years ago, and again is adhered to or has been slightly modified. But this grading system has a category 1 defining a essentially normal endometrium and giving it the best prognosis. A category 2, which may be subcategorized into A and to B, and a category 3 that is associated with a widespread pathologic change or changes that drastically reduce the chances of foaling all the way down to about 10%. A certain amount of seasonal changes needs to be taken into consideration as well. And the European pathologists also assess the certain vascular changes of lamina splitting and muscular hypertrophy in categorizing the assessment of an endometrial biopsy. We are looking at what is a category 1 normal endometrium as best as it can get. Textbook, histologic textbooks, everything is very regular. Here's a category 1 being characterized by a focus of inflammation. Category 2, another type of change leading to the classification of category 2 is associated with glands known as periglandular fibrosis. Here is a change of periglandular fibrosis, which is quite extensive and would classify this biopsy as being category 3. And here is such a situation relative to an inflammation, a severe involvement, separating glands and destroying glands, also would lead to a category 3 classification. An example of splitting of elastic fibrils in a major vessel, as demonstrated by this special Van Gieson stain. Tumors associated with external genitalia in the mare, just like in the stallion, can be a squamous cell carcinoma. I would like to continue with diseases of the gravid uterus. This slide represents the situation as far as the placentation of the mare is concerned. It is classified as a diffuse placentation at the gross level and then microscopically as being epitheliochorial. We are looking at the chorionic surface of the chorion allantois, being always characterized as a velvety, richly blood-supplied surface versus the amnion, which is translucent, very thin, and characterized by the presence of prominent muscular arteries. Again, it's a diffuse placentation. Both placental membranes are covering the umbilicus, and here again it is a nice demonstration of the amnion as it contains very prominent muscular arteries. One also should recognize a structure known as endometrial cup that is a normal component of the pregnant uterus. These are truthfully called cups because they are raised and have an indentated center, clustering typically in the body of the chorion and being typically of fetal origin and responsible for maintenance of pregnancy between 40 and 120 days because they are producing certain hormones involved in the maintenance of pregnancy. Microscopically, here again another set of endometrial cups. Microscopically, they are characterized by trophoblast-like an appearance, separating endometrial glands with a prominent nucleus and a very prominent eosinophilic cytoplasm. They spontaneously regress somewhere around day 120 of gestation, and at that time one can see associated with these structures many of the lymphocytes, which should not be confused again with a placentitis. Likewise, during certain phases of the mare's pregnancy, accessory corporaludia develop in the ovaries, which should not be confused with a diagnosis such as a luteoma. These are physiologic and also are responsible during a certain period of gestation for maintenance of pregnancy. So this entire ovary is replaced by corporaludia. And then thirdly, there are certain physiologic areas of Villus atrophy, such as the chorion rests against the internal os or the tip of the horns of the uterus. If it is the situation associated with the internal os, this structure is defined as endometrial star. Again, it should not be confused with pathologic states of chorionic villus atrophy. One instance that causes sudden death in late gestational pregnancy in the mare is associated with the rupturing of the middle uterine artery, leading to hemoperitoneum, as you can see here, and a inspission of the entire uterus as well as a broad ligament with blood. And here again is the site of tear. It happens in older mares that have gone through repeated pregnancy, and the principle why it happens I already alluded to as far as the older stallion is concerned and aortic ruptures. It is an aging process, a weakening of the wall of the blood vessel, in this instance the middle uterine artery, due to necrosis known as Erdheim's necrosis, media necrosis. A scenario where maintenance of pregnancy is not possible due to an absence of enough villi is seen here, where the entire body of the chorion is avillous, and the process, whatever the nature and reason for it, stretches into the horns. This is certainly incompatible with pregnancy. Severe Villus atrophy. Abortion diseases are either non-infectious or infectious. A typical scenario of a non-infectious cause of abortion is twinning. This is somewhat the most important non-infectious cause as far as equine abortions are concerned, and can account up to about 30% of the aborted material submitted. It is hypothesized that insufficient placentation of dizygotic twins results in death of one or both, as seen here, and subsequent abortion. This is a scenario where one of the twins already had been dead for quite some time and is undergoing decomposition as far as this twin on the left is concerned, versus the right, which is a freshly aborted twin. If one then looks at the placental membrane, at first glimpse, it may not really be indicative that there isn't simply enough placental tissue left. In order to make this assessment, one almost is obliged to weigh the placental membranes. That's in many instances not possible because they are past that when picked up by predators. So this attempt, this hypothesis, may or may not hold true, other than that we know twin pregnancy in the mare is associated with a poor prognosis towards survival. Here is a set of twin placental membranes that shows maybe a reason why intrauterine death and abortion occurred, and that reason is that at least the chorion on this side is involved in a larger area of avillousness, and that may be just enough of villus atrophy to interfere with the maintenance of pregnancy. A second cause of non-infectious abortion disease in the horse is twisting of the umbilicus. However, one has to be very careful in that assessment as well, and not fall into the trap to immediately make this as a diagnosis and a cause of abortion, because one has to realize that the umbilicus normally is twisted and has a certain set of resolutions, up to about 15, depending obviously on the length and the breed of a horse. So one can actually then count, if one counts significantly more resolutions, it may help to establish the cause. But more importantly, if that really is the cause for the abortion, one has to look into the urachus and umbilical veins, and particularly for evidence of thrombosis. So that will be a helpful observation and criterion for the diagnosis of excessive umbilical twisting as being responsible for the abortion. In some instances, it helps to see that the umbilicus has strangulated the hind legs or the body or even the head of the aborted fetus to assess at least an umbilical involvement in the abortion, and maybe not necessarily an excessive twisting. Infectious causes, again, maybe viruses, bacteria, fungi. Here is a case of equine viral arteritis abortion. The pathogenesis is interesting in that it is actually the mare or tissues or lesions in the uterus of the mare that are responsible for the abortion. The vasculitis of the blood vessels of the uterus are responsible, and not a direct viral impact on the fetus or the placental membranes. One cannot really isolate the virus from placental membranes or fetal tissues in a situation of equine viral arteritis abortion. One has to investigate the mare for evidence of antibodies in order to make this as the cause. A more obvious and frequently different virus being responsible for abortion disease is equine viral abortion virus, equine herpes virus type 1. It typically results in the abortion of a fresh, dead fetus and the identification of very, very small but nonetheless visible white foci in the liver. It affects obviously also the lung and tissues of the lymphatic system as well. But at the gross level, it helps to see these small white foci to suggest herpes virus abortion. It also helps to see blood clots associated with the distal trachea and the bifurcation of the bronchi. It also helps maybe to see lung. This one does not show it, to show rib impression, to suggest a fetal pneumonia, and indeed that is the case. But it certainly helps to identify the typical inclusion bodies in affected organs such as the liver, such as the lung, such as the spleen and thymus and what have you. A variety of bacteria, mainly gram-positive bacteria, in an ascending fashion can cause a placentitis and then result in abortion disease. Here is such a scenario where Streptococcus organisms were cultured from the chorionic surface, which has this leathery, thickened appearance and is covered by a purulent exudate. I would like to say a few words as far as one of the more combined non-infectious and infectious factor disease that had hampered the industry in Kentucky, the horse industry in Kentucky a couple of years ago, defined as pregnant mare reproductive loss syndrome. I personally have not made any experience, but it is a combination of factors that mainly centers around the role of the caterpillar and its hair, known as setae, that apparently is, when consumed by pregnant mares, travels vascularly into the site of the placentation and carries along as hitchhikers a couple of bacteria, gram-positive bacteria, mainly streptococci, to cause an omphalophleboides and a placentitis that results in abortion of either the early fetus or the late fetus. Again, these setae, these hair-like structures and associated hitchhiking bacteria also may affect the pericardium. They may cause a uveitis and also an encephalitis. Again, it's an excessive replication of caterpillars during certain years in conjunction with cherry trees that has led to this type of working hypothesis as far as the mechanism is concerned, causing the pregnant mare reproductive loss syndrome, which apparently had cost the economy quite a bit of money a couple of years ago, and I think it's still not fully recovered from the loss of folds. Leptospirosis could be another, just like another pregnant mammalian species, bacterium involved in abortion disease in the horse. It causes in the aborted fetus a interstitial nephritis that is at the growth level characterized by these white foci. Microscopically in the liver one can appreciate hepatocytes that are multinucleate, also defined as multinucleate hepatitis, though it I think is a multinucleated inflammatory cell, but these are hepatocytes that either show karyomegaly or multiple nuclei. Again, I think it can be a problem in certain states and certainly has been best worked up by our colleagues in Kentucky. On to the hemolymphatic system, being represented by spleen, lymph nodes, and bone marrow. There isn't really very much to demonstrate, but a few entities. These cracks on the surface of the spleen are common normal findings, fissures that should not be confused with fractures that lead to hemorrhage. Almost each and every spleen of each and every horse has these fissures on the surface, so this is a normal finding. Likewise, on occasion, one can appreciate the duplicity of spleens, two spleens developing. This is not a mother spleen and a daughter spleen. These are truly two independently developed spleens. Duplication. And then splenomegaly. Splenomegaly being sort of a garbage and collective term to designate an enlarged spleen. It somewhat should be differentiated from hypersplenism, which is defined as a spleen enlarged from an overactive red blood cell destruction. Splenomegaly as an entity doesn't occur that frequently in the horse and can be associated with something like pyroplasmosis, equine infectious anemia, anthrax, lymphoproliferative disease, grass sickness, as we have seen as well. Here's a case of a spleen or portion of the spleen that shows up on the right side of this animal. We always perform our necropsies in left lateral recumbency. So if a spleen shows up in that position, it clearly indicates either an enlargement or a dislocation of a spleen. This was an enlarged spleen. Here's a spleen that is of normal size, but what one can appreciate is the fact that the hilar lymph nodes are enlarged. This can be seen again in conjunction with a lymphoproliferative disease, lymphosarcoma, but also in infectious diseases such as equine infectious anemia. Here is a splenitis in conjunction with a bacteremia, causing somewhat an enlarged spleen, but also some hemorrhage into the splenic capsule. Here is splenomegaly characterized by nodularity due to maybe a neoplastic situation, or again a myeloproliferative disease, or it could be anthrax. Nodules, individual nodules in the spleen of older animals very rarely occur, and they're very similar to the occurrence of such nodules in older dogs, defined as nodular hyperplasia. Incidental findings. This probably was the largest spleen that I have had seen in a horse, occupying about 2/3 of the entire abdominal cavity. I forgot the weight, but it was somewhat about 40 kilograms. So this is a significantly impressively enlarged spleen that did not rupture, though. And one would think that whatever the process here was would lead to a splenic fracture and a bleed out, immediate bleed out into the abdominal cavity. It was a myeloproliferative disease disorder that we diagnosed. And then lymphosarcoma can enlarge the entire spleen, or causes nodules focally in the spleen. And here's such a situation that turned out to be a lymphosarcoma. Involvement pathologic diseases affecting the lymph nodes, lymphadenitis, inflammatory. Strangles should be mentioned here as an example disease, Streptococcus equi varieties, equi. Not to be seen that frequently anymore, as far as my experience is concerned. It's probably prevented quite nicely through whatever mechanism clinically is applied. I do not know. But the typical lymph nodes associated with a caseous lymphadenitis are associated with the head of the affected horse. And it may look as something like here. This is a tracheobronchial lymph node and a large tracheobronchial lymph node to release this creamy exudate strangles. Bastard strangle is an interesting situation whereupon the mesenteric lymph nodes are involved in severe enlargement, formation of necrosis and inflammation. As you can see here, the same creamy exudate. I do not have a picture, but this also may happen with perirectal lymph nodes, bastard strangles, involving all the lymph nodes, enlarging all the lymph nodes around the rectum. Some of them may rupture and cause a focal retroperitoneal inflammation. Here, another form of lymphadenitis and strangles, more organized. Enlarged mesenteric lymph nodes signalize a couple of scenarios that I already pointed out. First, a chronic enteric inflammation, such as Mycobacterium avium again, or Rhodococcus equi. They can be also responding to chronicity associated with intestinal salmonellosis. They also are seen as such to be associated with a myeloproliferative disease, lymphoproliferative disease, as well as lymphosarcoma. One cannot tell what the final situation is until one looks at these lymph nodes as they present themselves here as still individual but enlarged lymph nodes, what the pathologic situation is. Bone marrow diseases, again, lymphosarcoma, as we will see, can involve the bone marrow, or myeloproliferative diseases, which this one was the case here, affecting the bone marrow, leading to something like anemia, thrombocytopenia, and the like. Again, one also may want to think of an osteitis as well. It's not easy just to make the diagnosis by looking at it grossly from an individual bone. On to eyes. There is a condition in the tropical, subtropical climates that causes fungal keratitis, which may lead to perforation and a loss of visibility if not detected early enough and treated. We get many corneal biopsies to investigate either for the primary presence of fungi in the cornea or the effect of treatment that is either conservative or surgical. This was a case of a perforating keratitis due to Aspergillus fungus. Frequently also get biopsies from eyelids to investigate for the presence of tumors. Squamous cell carcinomas occur quite frequently in the horse's eyelids. They are very difficult to treat, mainly surgically, but also through laser or electrocution. These also are typical everyday biopsies in our accessions, and also the need to assess the margins for being free by tumor, or if a tumor reoccurs, the successful removal of a reoccurring tumor. So this is an ongoing process that engages for quite a long time, and in many instances our ophthalmologists, large animal ophthalmologists. And then historically recurring uveitis has attracted some people as to the nature. Is it responsible? Is it secondary to leptospirosis, or is it another event? Diseases of the endocrine system. One of those is exemplified by what's diagnosed as pituitary adenoma and is responsible for hirsutism or hypertrichosis. This poor chap in the middle of a summer, a long summer, is showing typically hypertrichosis, an elongated, very shaggy hair coat if you want. And it's usually an older horse that is then diagnosed with pituitary adenoma that I showed in the previous slide. So it's one of the endocrine disorders that do occur in the aging horse. The tumor rises typically from the pars intermedia, which is very important, and is different as such compared to other animal species. Older horses also have small tumors that are basically invisible, associated with the thyroid. They are adenomas, benign tumors. They are not visible basically if one does not slice through the thyroid, because they do not cause a thyroidal enlargement, an enlargement of the thyroid glands. Again, an age-associated tumor. However, in one of the cases, it was a malignant thyroid tumor that metastasized into the chest, thoracic cavity. I do not have the appearance of the tumor associated with the primary site, e.g. the thyroid, but this is a microscopic picture. It doesn't really look very malignant here, but nonetheless it has, just like tumors in the dog or in the human being, invaded lymphatics and blood vessels, then being quite evident that this is then a malignant metastasizing tumor. Adrenal glands. This is a case of primary cortical necrosis that may lead to a physiologic stage of Addison's. Due to mainly a endotoxemia, let's say starting from the intestinal tract, whereupon the necrosis is a result of hemorrhage through a loss of permeability of the adrenal cortical vessels due to the presence of endotoxins. This is also known as Waterhouse-Friderichsen syndrome. And here is an inflammation of the adrenal gland due to a very, very bizarre case of generalized nocardiosis. Tumors, like in other animal species, may start and arise from the cortex. As such, they are usually expansile growths, revealing themselves by the presence of a yellow color and a close association with the cortex. Here it's a more aggressive type of tumor arising from the cortex. That may be very well a cortical adenocarcinoma, destroying somewhat the entire adrenal. Again, usually unilateral. The histologic presentation of a cortical adenoma. And then the second site is the medulla. Pheochromocytomas may very rarely be diagnosed in the horse's adrenal as well. This is not very impressive, but nonetheless it was a small pheochromocytoma. This one is a better example in that it has somewhat grown into the cortex and certainly has enlarged the adrenal. Pheochromocytoma. The makeup is sort of an organized compartmental arrangement of adrenal medulla cells. On to diseases of the skin, which brings us finally to the exterior of a horse and involves dermatologists and dermatopathologists, and the horse is just as susceptible as any other animal species in the climate such as it exists in Florida. So the environment preconditions our horses towards certain diseases affecting the skin. Others may just occur somewhere else as well. And I certainly am not a dermatopathologist, and I will have some problems and present the diseases of skin in an organized fashion. And again, dermatopathologists, as dermatologists, have a classification and recognition pattern, which I think is very important. To recognize a disease pattern in the skin sort of narrows down the list of differential into a certain category. And the characterization of these lesions may start with hair loss, alopecia, vesicles, pustules, crusts, and nodules, really. So I'm going to somewhat use this approach and walk you through some aspects of skin diseases. The first one that is characterized by very focal alopecia, however, in a certain typical area of the neck of this horse here, but it also can be seen very close to the eyelid, is due to onchocerciasis. So this is a disease characterized by alopecia, and then if biopsied, will reveal the larvae of onchocerca in the subcutis. Basically, they're quite plentiful. I do not know the mechanism of alopecia associated with it, because it doesn't really elicit a significant inflammatory response. We will revisit the presence and the participation of onchocerca in fistulous withers very soon, shortly. Right here is onchocerciasis, Onchocerca cervicalis, involving in a destruction and inflammation of a nuchal ligament, which may be one cause of fistulous withers, not necessarily the only one. Onchocerciasis also may have a preference, as far as the alopecia is concerned, of the ventral abdomen or thorax, as you can see here. This may be also leukotrichia, but again, it's onchocerciasis. alopecia crusts, maybe vesicles and papules, are due to exposure to cholicoides, causing a hypersensitivity, cholicoides hypersensitivity reaction, which typically may reveal itself around the neck area, the head area, but also the tail area. Here, a little bit more extensive and a little bit more moist, perhaps. It's a type 4 hypersensitivity reaction that is seasonal, obviously, and depends on the severity of the population of cholicoides mosquitoes. Then lesions that start as vesicles may progress into papules, blisters, eruptions, and some kind of necrosis. Can be associated with a primary acantholysis, and these are typically the immune-mediated diseases such as pemphigoid foliaceus, pemphigoid vulgaris, and let's see, and pemphigoid. Here's a case of pemphigus foliaceus affecting the head. Also quite a bit of the body with these nodular elevations and areas of alopecia. Again, in order to make this diagnosis, one has to analyze the site of these clefts. If they are corneal, subcorneal, within the epidermis, it is suggestive of pemphigoid foliaceus, or one can, via immunohistochemistry or fluorescence microscopy, demonstrate the antibodies in the epidermis where the clefts have not formed yet. So this is again the presentation of pemphigoid foliaceus. Here is a case of pemphigus, and pemphigus has clefts suprabasilarly. In order to make a specific diagnosis, again another form of immune-mediated disease, starting as acantholysis, with autoantibodies being directed against desmosomal adherence molecules to start the process of vesiculation and then exfoliation. Pemphigoid has clefts subbasilar, as you can see here, but systemic lupus has to be also added in the differential diagnosis, which starts at the level of the basement membrane as again. So this is a subepidermal cleft and a subepidermal dermatitis, a couple of inflammatory cells. Here again a case of pemphigoid, but in the differential should be considered drug eruptions, necrotizing epidermiditis, caustic events, or whatever you have. This was a case of pemphigoid again affecting mucosal tissue, such as seen in here in this tongue. And again, cleft formation below the basement membrane and some evidence of inflammation. A case of nodules should bring about a set of differential diagnoses that I will have individual examples thereof, including cutaneous lymphosarcoma. This was and is a cutaneous form of heaves, so it's an aerated thing, with excoriation leading to secondary inflammations, as you can see here. Epidermolysis bullosa, causing vast areas of exfoliation and excoriation at the site of the skin of the body. And necrotizing epidermiditis is a differential diagnosis being characterized by severe necrosis and sloughing of the epidermis, also known as toxic epidermolysis. A case of drug eruption. Anyhow, I think the type of pathology overlaps quite significantly, and I think it's very important, I guess, for the clinician and the dermatopathologist to go into the history of any animals involved in severe skin conditions such as these ones. A case of dermatoparexis or Epitheliogenesis Imperfecta, Ehlers-Danlos syndrome, suggests a defect with a collagen tissue of a subcutis. And it also may affect the mucosa of the oral cavity. A vasculitis in the distal extremity due to Corynebacterium pseudotuberculosis, the organism is involved in pigeon fever. It may also cause severe exfoliative dermatitis in the skin of the head. Nodules and papules. This is again a case of cutaneous heaves. This is a case of collagenolytic granuloma involving the skin, also known as nodular necrobiosis, being characterized by areas of necrosis and deposition of minerals. If that would be primarily a situation where minerals are deposited, one also would have to think of calcinosis circumscripta in the differential diagnosis. Warts associated with the oral cavity and the muzzle. An example of viral origin of papules and nodules. Not to be confused with oak attaching itself to the muzzles of a greedy horse. This is a true viral infection. A primary exfoliative exophytic type of dermatitis has, however, a couple of nodules in the periphery here. This was due to the equine pox virus. This was a pox virus dermatitis, ulcerative. And another one being characterized by small nodular elevations, and alopecia was diagnosed as Molluscum Contagiosum, yet another type of pox virus that microscopically was characterized by these large vacuolic structures, ballooning structures really, of epidermal cells. This doesn't bring it up very well, but inclusion bodies were appreciated as well. a case of a tumor causing severe ulceration of the skin. Cases that may mimic exuberant granulation tissue or even some kind of neoplastic skin condition are due to a couple of fungi, or again this could be due to Heberomyces, summer sores. And in each case, obviously, the microscopic examination gives away the definitive diagnosis. This was Heberomyces. Again, in order to make the diagnosis, one has to appreciate the presence of either dead larvae or a magnitude of eosinophils. Cutaneous Heberomyces. Here again. Phycomycosis or zygomycosis mimics very much Heberomyces or eosinophilic or exuberant granulation tissue. This was some kind of eosinophilic dermatitis, as it typically can be associated with the skin and internal organs. This is a case of exophytic ulcerative dermatitis associated with the muscles and the skin of the nose due to zygomycosis. Again, mimicking very much a neoplastic situation. Here in the distal extremity, phycomycosis or pithiosis, showing evidence of sulfur granules. The cutaneous form of pithiosis is quite frequent in the southeast, in that these alga-like organisms are present in swampy pastures, and upon laceration, any laceration of the skin, quickly establish residency and causing a severe necrotizing granulomatous reaction that looks very nasty, and it's also very difficult to treat, and again mimics exuberant granulation tissue. The extent of the inflammation can be seen here in that it is expanding into the hoof wall and into P3, so it's actually causing an osteitis as well. And in order to make this diagnosis of either zygomycosis or pithiosis, one has to demonstrate hyphae that are polyseptate and poorly branching and relatively plump, with either a Giemsa stain or a PS stain. A wound, again, being characterized by severe ulceration and inflammatory reaction, exuberant granulation tissue, very difficult to treat and certainly looking very nasty and being associated with lameness. Here again, any of the diagnosis of granulation tissue, Heberomyces or pithiosis could be involved in the inflammatory reaction and necrosis of the distal extremity in this horse. Canker is a disease that affects the sole, the frog, and is not only very painful but induces lameness in affected horses, very difficult to treat. It's a hyperkeratosis basically due to the presence of gram-negative bacteria that have not been really specified very well. And it should have the differential diagnosis keratomas, which are hyperplastic changes associated with the squamous cell lining of the hoof. This is a case of canker. to show not only the hyperplasia, the hyperkeratosis, but also the necrosis on this low photomicrograph and on higher magnification, and with special stains, one will be able to identify the bacilli. Big nose, big heads. We already had one example as far as Brand disease is concerned, or nutritional hyperparathyroidism due to an excess of phosphorus, causing fibrous osteodystrophy of areolar bones of the head. Here's a horse that has a swelling associated with the nose, and on cutting through the skin is due to the presence of edematous fluid and hemorrhage. This is a snake bite, usually due to rattlesnakes or water moccasins, causing a severe local damage that may cause up to about 30% of such bitten animals a cause of death due to respiratory disorder, respiratory distress. I just did one very recently. It was a pony that had a deadly encounter with a rattlesnake. And despite heroic interference such as tracheostomy and application of steroid medications, it really went through respiratory failure and suffocated basically, because the local destruction of tissue necrosis, the local hemorrhage, edema, as well as systemic hemolysis and thrombocytopenia really can be fatal to such an affected horse. There isn't that much in the literature, but one of the papers typically describe that it is the head area that, when encountering the poisonous snake, causes the problem. Rarely do horses step on snakes, and if you do so, they're probably more successful in killing the snake before the rattlesnake can bite. So I think it's the curiosity, coming nose to nose with a snake, that makes the horse a loser. It's quite impressive. It's quite impressive what one can see associated with the head and the neck, and their severe pulmonary edema. The coral snake and their relatives produce a neurotoxin. So the encounter there is the neurotoxin that is fatal to the horse, which is very difficult to prove until one has really evidence that the horse being bitten by a coral snake is smart enough to kill it, and then one finds a dead horse together with a dead coral snake. One can put one and one together. If one would like to look for bite marks associated with the nose, it's very, very difficult to see, because by the time the tissue swells as such seen here, the bite marks simply disappear through the swollen tissue. Treatment with antivenom is very expensive in the horse, and usually then palliative treatment. And luckily, many of the adult horses, in a vast majority, escape dying from envenom. I would like to continue with another disease that is involved in the equine big nose syndrome, which is equine amyloidosis. This is my first slide to characterize a pony that somewhat has evidence of an enlarged nose. Equine amyloidosis is a rare disease as far as horses are concerned, and may affect internal organs, again the nasal passages or the skin. It is a primary amyloidosis that occurs independent of any other disease process. The two primary types of amyloidosis occur in the upper respiratory tract and skin. There's rarely a skin form only, But again, the second form may involve a set of internal organs. If we are dealing with secondary amyloidosis, mainly the liver and the spleen are involved. The diagnosis requires not only the histopathologic examination of the organs infected, but also special staining. This was a case of nasal amyloidosis being characterized by a very dry, dense, what at first sight looks like inflammatory infiltrate, but these areas are amorphic, pink areas, when specially stained and subjected to Congoret, showed evidence of amyloid. There is a cellular reaction to the presence of amyloid characterized by multinucleated giant cells and some plasma cells. A case of cutaneous amyloidosis being associated with alopecia. It's depicted in this horse. And then the internal organs can be involved either as far as the abdominal cavity or the thoracic cavity is concerned. A tumor-like configuration of large nodes are quite obstructive as far as the involvement of the pelvic canal are concerned. Here are a couple of nodules that are very loosely attached to the peritoneal cavity, stain positive with Congoret. So this was a case of internal amyloidosis, primary amyloidosis, and it also affected the heart as well as portions of the lung. A case of Phlegminous dermatitis again mimics the previous examples of etiologies that I presented. And this was a case caused by Staphylococcus epidemicus. Localization and demonstration of the extent. And then a simple case of exuberant granulation tissue. Fistulous Withers is an inflammation and swelling and enlargement of the nuchal ligament, causing pockets of pus and the presence of concretions. One of the etiologic principles we already alluded at and defined as being Onchocerca cervicalis, Brucella abortus, as well as Staphylococcus necrophorum or Fusobacterium necrophorum are bacteria that may be cultured from a fistulous wither, or it's also known as polyval. Here is a set of concretions, inspissated purulent material released from an opened fistulous withers. This Clydesdale has evidence of an ulcerative and maybe thickening of the distal extremities. This is defined as ulcerative lymphangitis, and it is usually due to Histoplasma fasciminosum. But Corynebacterium pseudotuberculosis can also induce such a lesion. Disseminated sterile granulomatosis, equine sterile granulomatosis, also known as equine sarcoidosis. It should not be really confused with the equine sarcoid that we will cover very, very soon. Equine sterile granulomatosis is an inflammatory condition, but it is of unknown etiology. The condition somewhat resembles human sarcoidosis, and again, in the horse, it's also defined as equine idiopathic granulomatous disease. There, microscopically, there's evidence of a widespread non-caseating epithelioid granulomatous inflammation involving one or more organs. An etiologic agent is not isolated. Immunologic defects may be such as polyclonal gammopathy, interleukin-1 increase, and depression of a delayed type of hypersensitivity are hypotheses postulated to be involved in this sterile granulomatous disease. Here's an example affecting the skin. Here's another example affecting the skin. Again, other considerations need to be added to the differential diagnosis. Microscopically, it is composed of macrophages, every so often giant cells, and a decent number of fibroblasts. Sterile granulomas associated with pleura of the lung. I've seen it also associated with the serosal surface of abdominal organs, including the uterus. A couple of examples of primary skin tumor. The most popular is known as equine sarcoid. It has a couple of preferential sites, such as the head or the leg. Here it is in both sides, on either side of the eye. Here is an equine sarcoid associated with skin of the distal extremity. Here another one, a little bit more prominent. I would like to continue with the equine sarcoid as being one of the more frequently occurring equine skin tumors. Microscopically, it's characterized by the presence of small whorls or bundles of delicate fibroblast or fibrocyte-like cells that are oriented in a picket fence fashion at the site of the basal lamina and intimately associated with the epidermis. This is sort of a hallmark in the makeup microscopically of the equine sarcoid. Again, it should not be confused with a fibrosarcoma. It's the thumbprinting and the picket fencing that makes the equine sarcoid very typical and amenable for such diagnosis. A second type of skin tumor is a melanoma, typically affecting gray horses, older gray horses. And a preferential site is the perineum, or the base of the tail, the skin over the rectum. And here's such a case in an older gray horse. Nodules that are deeply dark and black pigmented, slowly metastasizing to the next regional lymph node. They can be removed, obviously, but they have a tendency to recur locally. And in some instances, if they are completely left alone, the rate of metastasis ultimately will reach some organs of the abdominal cavity. Up in the front, there is a unique situation that develops associated with a primary site of a small melanoma associated with the eyelid here. If one then dissects the skin away, it becomes evident that the melanomas have occurred in other sites, typically associated with the salivary gland lymph nodes and the submandibular gland lymph nodes. Just a small site, however, the tendency to locally metastasize is quite typically. That has not been published, but it probably escaped detection because in many instances animals were not skinned such that when the exposed regional draining lymph nodes were seen and investigated for the evidence of metastases. here it also involved the opposite side of the submandibular lymph node. So one has to look for a primary site up front, and that primary site frequently is the eyelid in the horse. A case, and the only one, of cutaneous mast cell tumor affected the skin over the metacarpus. At the gross level, the tumor revealed itself by this greenish discoloration, and microscopically it was composed nicely of a monotonous set of round cells when subjected to Giemsa stains or toluidine blue, showed evidence of metachromasia, and also somewhat along as a hallmark, a couple of eosinophils can be appreciated to be interspersed with the cutaneous mast cell tumor. And then finally, the cutaneous form of lymphosarcoma, characterized by multiple nodules elevating the skin over the body and also the legs and the head area. It's an interesting tumor that has been identified, as far as markers are concerned, to be mainly of T cell origin, but also to be rich in B cells. So it has neoplastic lymphocytes belonging to both lineages. Here the presentation of the subcutis being involved in the formation of areas of nodules that microscopically then showed two populations of neoplastic cells. One, a lymphocyte that sort of is expected size, and then a more histiocytic cells that frequently also had evidence of multiple nuclei, so it's being the second time. So it's a primary lymphocytic and then also histiocytic component that is involved in the formation development of the cutaneous form of lymphosarcoma. The final segment then is meant to represent a couple of neoplastic growths as they may be unique to the horse, but also on a comparative level can be seen in other animals. The point here is, if one sees enough of horses with a neoplasm, one can pick up one that has been described in other species as well. So I just would like to share a number of neoplastic growths that may affect typically internal organs. We already alluded to some affecting the skin. We will be back as far as the skin is concerned and the involvement in other neoplastic cutaneous growths is concerned. Here's a horse with a significant swelling distal to the mandible, which was diagnosed as squamous cell carcinoma that affected then also the nasal cavities. Here's another tumor that was diagnosed as amyloblastoma. It could be also an odontoma, usually in a young horse, originating from structures belonging to the tooth. Here's a scenario that involved lymph nodes. It involved areas in the thorax. It involved areas in the abdomen. It was seeding on serosal peritoneal surfaces, large nodules, smaller nodules. It was seen on the surface of the liver. And the diagnosis was that of a malignant mesothelioma. Obviously, it needed to be characterized by identifying markers, and these markers were both positive for vimentin and cytokeratins. Microscopically, an array of spindeloid cells loosely interconnecting with each other and maybe a matrix that might show some mucinous substance. Here a little bit a more cellular and hypercellular configuration of these cells. Here a little more loose a configuration with a very mild fluid in these empty spaces. And somewhat along in some areas it either reached or arose from what appears to be a mesothelial surface. So mesotheliomas, malignant mesotheliomas, we have seen a couple of them have been described to be quite aggressive in the horse. These horses obviously had clinical signs of emaciation and weight loss and whatever you have. A case that at first glimpse of neoplasia, case of neoplasia, involved the liver here. Was diagnosed as a very malignant hepatocellular carcinoma. And also a second case involving the liver and other viscera was a mast cell tumor, a disseminated mast cell tumor showing metachromasia. This horse had clinical signs of fever of unknown origin and a eosinophilia. Here is a set of mediastinal lymph nodes to be involved in the process of neoplastic transformation and infiltration by mast cells. Likewise, aspects of the chorda tendineae had these small nodules which turn out to be neoplastic mast cells. A case of schwannoma arising from nerves associated with a hind leg, characterized by spinduloid cells again, that's been positive for markers belonging to Schwann cells. A case of nephroblastoma affecting and enlarging one of the kidneys. In a more young horse, as also on a comparative level seen in human beings and pigs. One somewhat can appreciate abortive attempts to form glomeruli, or one can call these also as juvenile embryologic glomeruli. And the case of a tumor affecting the mammary gland, a mammary gland adenocarcinoma. Granular cell tumors, if they are detected in the dog, typically are seen in the lung. They are small nodules, yellowish, very discrete, and more or less incidental finding. Somewhat preferring as site the hilus of the lung. But they also can be within the pulmonary parenchyma, but the key is it's a yellow looking neoplasm that is very discrete and defined as far as its size is concerned. Microscopically, it's characterized by small round nuclei that may be peripheral and a large eosinophilic cytoplasm, a staining eosinophilic cytoplasm that, when subjected to PAS stain, will stain positive. And then, very rarely, but nonetheless existing and occurring in horses too, a primary lung tumor, creating a generalized enlargement of the lung. And here's a cut section, and again we have seen such a cut section associated with the idiopathic interstitial pneumonia of adult horses. So that would be then the differential diagnosis, primary neoplasia, and it was a bronchoalveolar type of neoplastic growth that revealed itself microscopically as demonstrated here. This is a case of squamous cell carcinoma. However, it also was involved in a paraneoplastic syndrome, being characterized in this horse by mineralization of soft tissues, particularly as far as major arteries are concerned. Certain tumors in the horse, such as lymphosarcoma and squamous cell carcinoma and hemangiosarcomas, have been reported in the literature to produce the paraneoplastic syndrome. This was the primary site in the non-glandular part, and one can appreciate that the ascending aorta here is roughened as far as the surface is concerned, and on palpation this roughening palpated very firm. It was a very gritty evidence of mineralization, and it extended into other portions of the aorta as well. A case of adenomatoid polyp, polyposis, associated with a small intestinal tract of a horse that had clinical signs of protein-losing enteropathy, had multiple nodules elevating from the mucosal surface, and the microscopic appearance was that of a neoplastic architecture that was closely associated with the mucosa, but certainly was characterized by the formation of acini and tubules, being arranged in a sessile fashion as far as the parent tissue is concerned. And here again. So the diagnosis was that of an adenomatoid polyposis. It was a standard bred horse. A case of hepatic involvement, stomach involvement, again the liver being removed, showed multiple nodules, could at this level be assumed perhaps to be a case of squamous cell carcinomatosis that metastasized to the liver. Here again, the cross-section through the liver. Microscopically, it sort of had the appearance of an endocrine tumor, and it certainly was, by a special stain, diagnosed as a chondroid. It was positive for somatotrophins. So a chondroid, a rare tumor, but why not in the horse? One just has to see a lot of these horses or neoplasms in horses in order to be fortunate to identify one on a comparative basis that occurs comparatively more frequently in other animal species. A tumor sort of distorting the gross appearance of major portions of the intestinal tract. Here's the stomach, here's a portion of the colon, here may be either a tumorous growth or a portion of a cecum, I do not know. Anyhow, a lot of nodules sort of interfering with the anatomy of the gastrointestinal tract, also involving surfaces such as the spleen. And the stomach was diagnosed as a fibrosarcoma, but that easily could be also have been misdiagnosed because it could be as well a gastrointestinal stromal tumor, which again, when subjected to certain markers, is made up of myogenic and neurogenic cells. But anyhow, we made the diagnosis of a fibrosarcoma because of the whirly, bundling appearance of elongated cells that at least to us looked like being very much suggestive of a fibrosarcoma. And then a leiomyosarcoma is depicted here again, and I already presented that. So that's a smooth muscle tumor that originates from anywhere of the muscular tissue of the GI tract. On to lymphosarcoma. We already talked about the cutaneous form of lymphosarcoma. There's an elementary form of equine lymphosarcomatosis, and then a third one known or defined as multicentric form of lymphosarcoma. Again, if one strictly is confronted with the lymphosarcoma affecting the skin or subcutis, it would be the cutaneous form. If various portions of the gastrointestinal tract, including the mesenteric lymph nodes, are involved, it would be then the elementary form of lymphosarcomatosis, and then multicentric affects organs such as liver, spleen, kidneys. And here is a scenario where I think it is multicentric, because it seems that not only the mesenteric lymph nodes are involved, but also there's involvement of the liver. Here is a case of elementary lymphosarcomatosis showing an elevation, a plaque-like elevation of the mucosa, most likely being pious patch lymphoid tissue that is involved in the neoplastic transformation, and a little bit of the mesenteric lymph nodes here. Here again, a set of grape-like growths of mesenteric lymph nodes that may be indicative of chronic inflammation, but again, in this instance, it was associated with the it was indicative or diagnosed as being part of the elementary form of lymphosarcomatosis. And a representation of the neoplasm at the microscopic level. Here's lymphosarcoma affecting the spleen primarily, but there also seems to be evidence of a lymphosarcomatous transformation of perhaps associated lymph nodes. Here, when opened up, it doesn't have the typical fish meat-like appearance. It looks more solid, it looks more firm, and it looks more that maybe it is more a different mesenchymal type of tumor, such as fibrosarcoma or leiomyosarcoma, but anyhow, the diagnosis was that of a lymphosarcoma. Lymphosarcoma in a nodular fashion affecting the liver. Here again, multilobulated, looking firmer than in other maybe species. And then affecting the bone marrow as well, replacing large portions of the marrow. So secondary diagnosis would be of a myelothesis, and indeed this animal probably had changes of disorders of coagulopathy or thrombocytopenia. Here again a close-up, just like in a cow. In this horse, part of a multicentric lymphosarcoma form. Here to show thrombocytopenia and a coagulopathy associated with lymphosarcomatosis, multicentric widespread lymphosarcomatosis. Probably that might be the same animal. A very rare site for a lymphosarcoma in the nasal cavity, lymphosarcoma affecting the nasal passages, seen here. And yet another bizarre site, unusual site for lymphosarcoma, the pharynx, probably associated with the tonsils. Looking, and I remember this case because I misdiagnosed it at first glimpse, very much like the cutaneous form in that it was composed. Yes, it was composed of lymphocytes, but it also had multiple multinucleated cells. It's fooled me a little bit. And then lymphosarcoma may affect the orbit to extrude the eye. So this was the ocular form or periocular form of lymphosarcomatosis. If one sees enough thereof, one probably then can compare the appearance and the biologic behavior in the horse to that as far as cats or dogs or even the cow is concerned. And then finally, a case of hemangiosarcoma. This one did not show clinical signs of the paraneoplastic syndrome. It just affected the skin, and that probably was the primary organ, but it metastasized into the lung, as one can see here. Hemangiosarcomatosis or hemangiosarcomas affecting the skin have been described on occasion. So have a disseminated hemangiosarcoma. This is the only case that I saw. A close-up of the lung, mimicking somewhat also a melanoma. That could be also a metastasis of a, if you want, skin melanoma, but this was a case of hemangiosarcoma, but blood-filled cystic structures. I'm basically at the end of my presentation. So this is a bunch of horses that are looking forward to reach the end, one of them hopefully the winner. But before I really phase out here, I would like to thank one more time my organization, the College of Veterinary Medicine, to make this all possible. So thank you for your attention, and I hope you enjoyed the presentation.